Welcome to Alicia Spence, Director of Services at ACCI, the African Caribbean Community Initiative. Today we're going to talk about World Mental Health Day. So, what is World Mental Health Day?
World Mental Health Day is a day which is celebrated internationally, and it focuses on raising awareness around the issues of stigma, social injustice, prejudices, and abuse of people who have experienced or who are experiencing mental health challenges. And so the day is really about bringing the issue into people's faces so that it helps to destigmatize mental health.
On a personal level, what does World Mental Health Day mean to you?
I guess as someone who has worked in the mental health field for the past, say, 40 years, I have a personal commitment to educate and raise awareness within our own community and also the wider community at large.
How does ACCI recognize and celebrate World Mental Health Day?
In the past 21 years or so, ACCI has consistently planned and executed events to celebrate World Mental Health Day as part of our attempt to raise awareness, as I've said previously. And this event has taken many forms. We used to have just a half-a-day event. We've had just maybe a conference or something like that. But certainly for at least the past 12 years or more, in conjunction with Jubliee Christian Centre here in Wolverhampton, we have worked in partnership and collaborated and put the event on. Initially it started off where we would have the event at a Sunday evening meeting, and then it was decided that in order to get full attendance and to ensure that we were having maximum impact, particularly in our faith communities, where unfortunately there is as much stigma as there is outside of the church community. And so we've been hosting this event as part of the mainstream Sunday morning service. And this has been of tremendous value to our organization, but to people experiencing mental health problems. And the format that's taken generally is that the host pastor, we meet together prior to the event, plan the program for the day, and there's input from the local church. But more importantly, the input has been from our members, as we call them, our carers, our staff, our volunteers, and our community at large. You know, the feedback always is that every year we've had new people come in, and every year people say they've gone away with a much better understanding and less fear about people experiencing mental health problems. Because, you know, for a lot of people out there, not having the understanding and the awareness in itself creates a lot of fear. And with that fear sometimes comes prejudices, and I'm talking about prejudices against people with mental health problems, because the understanding isn't there. So it really has been of phenomenal value in terms of raising awareness.
How has COVID impacted on yourself, staff, and the organization?
I mean, I think all of us, whoever we are, whether we are experiencing mental health problems, and certainly we know that there's been an increase in mental health issues since COVID, with all the isolation, the kind of information overload that's been there, the conspiracy theories, everything. And, the amount of kind of unprecedented bereavement that people have had to face, that it's had a profound impact on all of us. On a personal level, I've had to kind of find ways of coping with, the challenges that we're facing, particularly managing, an organization like ACCI, where we have our members who were just as impacted by what was happening out there, especially in the initial stages. People couldn't get to the shops, they couldn't get food, the isolation, all the information, you couldn't turn the television on. Every channel was all about what was happening. It was all such kind of doom and gloom. And for a lot of people, their levels of anxiety increased. So it was a very challenging time. I think for us here at ACCI, one of the things which kept us was that we've got a very good staff team. And so we worked together, supported each other, and tried to kind of see the lighter side of things where we could, for want of a better phrase. But supporting each other and in turn being able to support our members, many of whom, as I said, weren't coming out, they were staying in. People, we had to temporarily reduce access to the hub because of the guidance from public health and things. But we still maintained the service in terms of their outreach team continued to work, the staff in the hub continued. So what we were doing was outreaching to our members more on an individual basis and to our carers. And I think that, and we did things like we increased our meals, cooking and delivering meals, doing shopping for people who weren't able to, and generally just rising to the challenge. And I think sometimes maybe some of us, it was almost like we were too busy to even become caught up in some of what was happening. Because most times, you were just so busy doing things, and then the rest of the time you were tired, so you'd sleep. But I don't think any of us was untouched by what happened. Fortunately, the organization, as I said, we were able to maintain our service so that our members and carers knew that there was a lifeline, there was a service that they could call on. And there's a song which a favorite of mine at the moment in the area, which is Give Thanks.
Give thanks, give thanks, give thanks, give thanks, give thanks for all that is. Give praise, give praise, give praise, give praise. Give praise for all that is. There will never ever be another day just like this day, so let's give.
And that was something that I personally played almost daily as a ritual. And so it was almost like however bad the situation was, whatever was happening, give thanks, because there were always other people in a worse position. And all of us experienced bereavement, distress, related to family, friends. And it was hard, but like I said, the main thing was to give thanks, because at least we were alive and we had our sanity, and that was so important. But we know that, there's been a phenomenal increase in mental illness, especially amongst young people. A lot of young people, we're increasingly now we're hearing of cases with some of the mental health conditions with young black people, particularly like, things like self-harm, suicide, which at one time, in my experience of working mental health, wasn't one of the common diagnoses amongst our community, but we're seeing an increase, and because our young people don't have the resilience for.
Is there any type of gender differential with that as well?
No, I'm not in a position to say because I haven't done any research. So, I could say I've seen more of this type, but that may be just what I see locally. So no, I'm not at liberty to say, but it's sadly it's on the increase, and we're seeing a lot more younger people get phone calls from families distressed all the time saying, I've got this and I don't know how to deal with it, and how can you help? So that's been one of the fallouts from the pandemic.
So the service have been actively supporting members of the community throughout.
Throughout.
The
Yeah.
pandemic.
Yes, absolutely. We haven't stopped. We were one of the few services, I think, who remained open throughout. And although we initially, for a couple of weeks, we had to stop people coming into the hub, into the center, until we were able to put the correct PPE in, for everybody's safety. But once we're able to do that, we then organized, as soon as we're able to, people in bubbles, small groups, and so that they could at least come in, even once or twice a week, which they found therapeutic. Our counseling services worked throughout. Obviously, they had to do a lot of the counseling online, but they also did things like doorstop visits where they actually visited our members so that there could be some, knock the door, step back, but have some kind of eyeball contact, which for some people was what they needed.
How will ACCI be celebrating World Mental Health Day this year?
Unfortunately, once again, because of COVID, and we this year we will be celebrating it online again as we did last year. We had hoped, and we were working towards, doing it live, but it's not possible. But we're confident next year we'll be able to do it. So this year we have Paul Gray, who's spoken on a number of occasions at our event. Yes, very powerful speaker.
He spoke last year as well.
He did, yes. Very inspiring. You listen to Paul, you don't come away uninspired. Very, very inspiring and also very entertaining, engaging, because you can kind of, connect with what he has to say. Also, we have Angela Corina, one of our members, who's actually released an EP, and she'll be performing. Daphne Dennis, as always, the Jubilee Christian Centre team, and also Steve Jacobs, the minister, and other people. We'll have Talika Malcolm, one of our members, who'll be giving the perspective. And so it's going to be done online. We'll have the details out soon for the link. but we're sure, and then we're sure it's going to be, you know, a very, once again, very inspiring and therapeutic event. But the important thing is that it's going to happen in whatever shape or form. Again, it's going to hopefully inspire people and uplift their spirits and raise awareness. And with it being online, hopefully we have a wider audience, you know, so that the word is getting out there, and we begin to destigmatize and reduce some of the fear and the misinformation surrounding mental illness, and particularly our own community, where there's a lot of stigma and a lot of misunderstanding and ignorance. And yet there's hardly any one of us who haven't got a family member or a relative or somebody we know that has experienced. Every family can tell a story. And so we really do need to begin to develop our understanding